cut along, right? Notice how I'm keeping my scissors flat and I'm lifting this muscle layer away from the organs underneath because I don't want to hurt any of that stuff, right? And then I go straight up until I hit the diaphragm, right? And then I'm going to stop, okay? So, so we got to make this flap open. So I'm going to make a little flap sort of at the top of each leg, right? So like where the thigh is, more or less. So we just kind of flap, 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 flap. Now, the inside of your bunny may or may not be really liquidy and gross. Not too bad. Yeah, so bottom flap is good, right? And so then I'm going to make some flaps up here too. So I'm going to feel where the ribs are, right? And the bottom rib is like right there. So I'm going to feel where the, right, feel for the ribs. Oh. This is the liver, okay? So the diaphragm, so this is the liver.
Oh, okay.
The diaphragm is the reason my fingers won't go up any further, okay? So what the diaphragm is it's, we haven't talked about it yet because we didn't finish the respiratory system this morning, but it's the diaphragm is the muscle that's used for breathing, right? And so it separates the thoracic and abdominal cavities as well. And in order, it's kind of dome shaped and it's attached to the whole body wall. And so in order to get up into this area, to the thoracic cavity, without damaging the diaphragm, the way that I typically do it is I make a snip going up the chest and then I lay the diaphragm flat before I continue cutting up, okay? Another thing to know about the chest is it's a lot easier to cut through costal cartilage, that's the rib cartilage, than it is to cut through the sternum. So I generally suggest instead of cutting straight up the middle to kind of veer a little bit to either the left or the right, it doesn't matter. And then you want to cut straight up, but not in the center, right? So just slightly off center, it doesn't matter which way, okay? So what I do is I make my first snip and then I stick my finger under here. So you guys who are here will be able to see it better from this side and then I'll turn around and show you guys. So see how I made the little snip and now I can get my finger on the other side of the diaphragm? Yeah? It's pretty thin, right? And then what I'm gonna do is I'm essentially just gonna cut along the diaphragm to try to leave it intact as much as possible so that it will lay down flat. Yeah? Okay, so let me spin you around there. Does he have a name? What's his name? Richard. Okay. It's very formal for a rabbit. Okay, so, right, I made the little hole, stick my finger in, see how my finger is on the opposite side of the diaphragm? And then I just kind of push the diaphragm away and just cut it away from the body wall. Because if I don't do this, when I open up the thoracic cavity, what it does is it just like rips the diaphragm off, essentially. So we'd rather not do that. We'd rather have a nice intact diaphragm. Right? So that's how we get the diaphragm to lay down flat. And then once the diaphragm lays down flat, then I just keep going up. Notice I'm keeping a pretty straight line. Even though it's not in the center, it's still a straight line. I'm not like veering off towards the arm. That's going to be important when we do blood vessels. So try to keep your line, you know, straightish, okay? And then what you're going to do is sort of as you get in there, just kind of get your fingers and separate, you know, separate things that are stuck together, okay? And all these nice muscles that we're so careful about. We don't really care anymore. Okay, so get up to the, you know, up to the neck. You can see the trachea, yeah? How do I know that that's the trachea right there? The rings, right? It kind of looks like a bendy straw. Yeah? So that's how I know that that's the trachea right there, because it looks like a bendy straw. Okay? All right, now the thoracic cavity. So the ribs are shaped like this, yes? The only way to get the ribs to open is to break them. Right? So here's my suggestion for how to do it. You would prefer to break the ribs on the back of the body rather than in the front, just because then you're less likely to snag your glove on it all the time, right? So I try to break them in the back. The other reason why you don't want to break them in the front is if you break them and they're sharp, you can actually, I've stabbed a couple semesters ago, a couple years ago, I stabbed my thumb on a broken rib and it bled. It was disgusting. awful. Okay, so see how I'm like reaching to the back of the ribs?
Oh, fuck.
It's like Rice Krispies. It's fine.
Oh my god.
Yeah,
So
we're like
it's
cracking
fine.
knuckles. It's fine. It's fine.
That was a good one. Oh, I feel better.
This is why my husband's afraid of me.
The sound I can't stand is
Do you want a massage? No, I'm alright.
No, I'm good. I'm good.
Oh my god.
Yeah, so see, stay away from me. Right? So see how it's open now? Yeah, because I broke them on the back.
Oh.
Yeah? Did you bring me paper towels? You're the best. Thank you. She's like, I know where this is going. This is going to get juicy, and I'm in the splash zone. Okay, so that's how we get the thoracic cavity open. Okay, and then the other thing we're going to do with our bunnies is we're going to open up their mouth a little bit. So tongue, teeth, right? We're going to get in the corner of the mouth here. And we're going to cut through. Some of you guys heard about it. I heard you guys talking about it this morning in the lecture with the Monday Lab people.
It's amazing.
Stop it. Okay, so I'm cutting through all the soft tissue first, through the masseter and all that stuff. Yeah. Okay, and I'm going to do it on the other side too. So just go through the corner of the mouth.
like Joker.
It is like Joker. Okay, so then once you get, oh wait, I'm not there yet. So you got to get through all this soft tissue, right? And then once you get through the soft tissue,
Dang it! I didn't get the
you got to break the jaw to get it open.
Oh,
Yeah.
Now I need to record.
Sorry, Diana.
Did you miss it?
Okay,
Okay, so yeah, so now the mouth is open all the way. Yeah, and actually, it works a little bit better if you.
Oh my god. I just see like.
It actually works really well if you kind of go all the way,
All the way back there.
all the way sort of down on one side. There we go. Right, so you don't want to rip this off, right? But you want to, on like one side, kind of pull it down like that. One thing you want to be careful about while you're rooting around in here is you want to be careful about blood vessels. You don't want to rip them if at all possible. Right, so do you see that little tiny thing in there? It kind of looks like a little, like a taco shell, a corner of a taco shell.
Oh yeah.
You see that? I mean like white people tacos, right? Like, yeah. I don't mean like real tacos. You guys see that? So if you don't, you'll see it on yours. That's the epiglottis, right? So we basically yanked his entire oral cavity all the way open, right? So that we can see all the way down to where his little epiglottis is sticking up. Yeah, so that's his little epiglottis right there. Okay, so let's just kind of start going through the list. So digestive system, let's do respiratory system, and then we'll switch over to digestive system, and then we'll do urinary last. So actually I'm going to talk about the hard palate and soft palate. We will talk about the hard and soft palate and what they do a little bit more when we talk about the digestive system in lecture. But essentially the hard palate is where it's hard. And why is it hard? Because there's bone under there, right? So remember the palatine bone and the maxilla that make up the hard palate? So this whole area is really hard, so it's the hard palate. And then it gets a little squishier, right? So like right around here, it starts to get squishy, and that's the soft palate, right? Right there. And the soft palate, the reason the soft palate is important is that the soft palate is a characteristic that's unique to mammals. And the reason it's really important for mammals is that what we use our soft palate for is to generate suction, right? And so it's, as an adult, it's convenient to be able to drink out of a straw. It's not required to survive, but as babies it is, right? So young mammals, baby mammals, the way that they get their nutrition is from sucking, right? And so the soft palate is what allows us to do that. So a soft palate is really, really important, okay? So that's the soft palate, hard palate, soft palate. I already showed you guys the little epiglottis, which is super cute. There's tongue and teeth and, you know, all that fun stuff, okay?
His dangling jaw.
Yeah, his dangling jaw. It's fine. Okay.
Oh, apple breaks the dangling.
Yeah. Anyway, okay, let's go back to the respiratory system. So then we have, so we already found the trachea too, right? It's got little rings, okay? if you feel along the trachea, you can kind of scratch it to like clean it off. You'll feel that it gets wider and kind of like, it feels different. It's bumpier. Up here, that's the larynx. So that's his little voice box, although rabbits don't really make that many noises, right? They kind of scream when they're traumatized, right? So,
When you
so
break their ribs.
larynx, when you break their jaw off, yeah, it's fine. Larynx and trachea, yeah? Behind the trachea, what am I expecting to find back here? The esophagus, right? Because we looked at the picture of that this morning. See how this all goes with what we're doing in lecture? It's like,
It's crazy.
it's super easy. Super easy. Yeah? So you see this thing that kind of looks like a rubber band? That's the esophagus, right? And so the way I got to it is I just kind of like scooped it out from behind the trachea. Okay? So that's the esophagus. It's right behind the trachea. Okay. All right, now we are in the thoracic cavity, but more specifically, what serous cavity are we in right now? So serous cavities, they all start with P. Do you remember learning the names of the different serous cavities? We learned at least one.
Oh, the pride.
So you're in the pleural cavity, yeah? Because that's where the lungs are. Okay, so let's get some things cleaned off. So this big like lump right here, guess what this is?
I don't know.
Lung.
The thing from this morning,
No.
the thymus,
Thymus.
right? So this is the thymus. I'm actually gonna go ahead and rip it off because it's in the way.
That's messed up.
I'm sorry, it's disappointing. But see that big old fat thymus? Yeah, so he was a youngster because he has a big old thymus, yeah? And then underneath the thymus is the heart, and we'll deal with the heart next time, right? We'll take off the pericardial sac and do some stuff with the heart later. For now, though, we're worried about the lungs and we're worried about the pleural cavity. So here's one lung, right? 1, 2, 3 lobes on the right side. Yeah, so we call them the anterior, middle, and posterior lobes of the lung. Yeah. On the left side, rabbits are kind of funny because they're supposed to have 3 lobes on each side, but I've discovered that in a lot of them, on the left side, the superior lobe is sad. So here, or not superior, anterior, middle, posterior, because they're quadrupedal. So the anterior, middle, posterior, posterior, middle, and then you see this little like flap. That's the superior lobe, I guess.
Is that the
But
top?
It's pretty small and sad.
Is that the top,
But
correct?
not superior. I keep saying superior. I mean
Anterior.
anterior. Sorry.
Oh, it's the inside.
Because
Anterior,
they're
middle,
quadruped.
posterior. Okay?
So it's 3 and 3?
Yeah.
That's the heart right there. Yep.
Oh, cool.
That's the heart in the middle. Okay? And then this dome-shaped muscle is the diaphragm that we carefully, it's going to have a ragged edge from where you cut it, right? But it sits over top of the liver, which we'll get to in a minute. Okay? So we're in the pleural cavity now, right? So do you remember how our serous cavities have a parietal membrane and a visceral membrane? So what am I touching right now?
Parietal.
I'm touching the parietal pleura. There's a lot of blood in here.
Oh, cool.
Gross. Right? So this shiny layer that I'm kind of trying to pick up is the parietal pleura. Where's the visceral pleura going to be?
Inside.
On the surface of the lungs themselves, right? So that shiny layer that's on the surface of the lungs is the
Visceral.
visceral pleura. Okay? All right. Diaphragm. That's the respiratory system. That was easy. Let's do the digestive system. So we already did the hard and soft palate. We already did the esophagus. Below the diaphragm, we'll deal with the liver in a second. We'll come back to that. You see this little